7:18 right now, and a new survey by the State Department of Health revealed an alarming trend regarding the mental well-being of Hawaii residents. So what did the study reveal, and what segments of the population were most affected? Joining us this morning with more is Kathleen Rhodes-Merriam, a mental health expert from the Department of Health. Good morning, Kathleen. How are you doing this morning?
Good morning. Aloha. I'm good. Thank you. How are you?
I'm doing excellent. Now, first off, Kathleen, what did you learn about this survey?
Well, this survey is very important because we now know exactly how COVID-19 is affecting so many people, that mental health really is something we need to pay attention to. So the survey conducted, it was conducted from December 30th to January 11th. That's a pretty short period of time to get this kind of information. And basically, 445 people were surveyed. That's a pretty good amount of people. And they described having mental health conditions such as anxiety, depression, loneliness, panic attacks, or just overall suffering from some kind of mental stress in the last 6 months. And so 82% of people said they're experiencing at least one of these conditions. And so we have to pay attention to that. People are really experiencing stress due to COVID-19.
Now, I also understand that there are certain segments of the population that are more impacted than others.
That's true. Thank you. So that's something to focus on too. We were able to tell from the study that males have a greater impact, that also Japanese residents have been hit particularly hard. Also, other segments of the population would be lower income adults and also young adults under the age of 35. The other thing that was interesting is that we found out that adults who live with children under the age of 18, and then even while males might be more likely to have a mental health condition, women are more likely to report and experience a wider range of mental health issues. So the study does give us a lot of information about how Hawaii residents are affected in their mental health.
Is that one of those things where men have too much pride and they don't want to admit that they might need some help?
Well, that's a good point. So there's lots of cultural variations. There's lots of generational variations that we could think about. People are very individual, and they kind of deal with a mental health condition very individually. Not everybody asks for help. Not everybody wants to say and admit that they have some kind of a condition or that they're experiencing different symptoms. But definitely the attention on mental health right now, and thank you for paying attention to it and getting the word out. We need to be focusing more on our mental health. It's part of our physical health.
Yeah, it's such an important factor, especially during the pandemic. And of course, Kathleen, you'll be joining us in the next hour because a lot of people are wondering, okay, change is never easy. How do we change? How do we seek out that help? And you'll come up with some tips and advice for that.
Absolutely. There is hope. There is hope. Thank you.
All right. Don't go anywhere, folks, because coming up next, Chris will have a live look at the roads.